Welcome to the HealthyGene podcast. My name is Sarah Kavanaugh. This is a podcast empowering cancer previvors and survivors over our hereditary cancer risk. We're all in this together, and I'm so thankful for your support. Let's dive in. Welcome back to the HealthyGene podcast. It's your host, Sarah Kavanaugh, and today we are talking about something that impacts more people than they realize, but it's just not being said out loud. When you see a headline about a public figure's cancer diagnosis, we often miss the chance to talk about hereditary risk, prevention, and what it means for families everywhere. That's where today's guest comes in. Jennifer Thompson is a board-certified genetic counselor and the founder of HealthyGene, a platform designed to make hereditary cancer risk more approachable and understandable. She's passionate about bridging the gap between science, public awareness, and real lives. In this conversation, we're going to unpack missed opportunities in media, the importance of proactive education, and how we can all do a better job connecting genetics with public health. Welcome to the show.
Thank you for having me. Excited to be here.
Now, a quick reminder, the show notes and extras from the podcast will be in the blog and in the show notes, so be sure to follow along on Instagram at HealthyGene Podcast. Alrighty, let's get started. Okay, Jennifer, tell us a bit about your background and what inspired you to start HealthyGene, and of course, tell us a bit about HealthyGene as well. So what can you unpack here for us?
Yeah, definitely. So as you mentioned, I'm a genetic counselor. I earned my master's degree from Northwestern in Chicago. After graduating, I started working as a clinical genetic counselor. I specialized in cancer, where I primarily saw patients with breast, ovarian, colon cancer who were referred for genetic testing, typically after they already had a cancer diagnosis. Just another kind of thing about my background, I also worked as a research genetic counselor. And my team's focus was really implementing genetics and genetic testing into primary care. So the goal was really to help identify patients who were eligible for genetic testing, like before they were diagnosed with cancer or another genetic condition. So in terms of where I started to think about HealthyGene, I really was noticing patients are often being referred to me in genetics after they've already had a diagnosis. And when I'd start getting into their family history and asking, questions about everyone in the family, they'd often have family members with cancer who were diagnosed either at a younger age, or maybe they had multiple relatives with the same kind of cancer. So based on their family history alone, I was like, you should have been offered genetic testing years ago before you even got cancer. So I can't even imagine as a patient how frustrating that would be if you knew this information. But as a provider, I was also very frustrated. These people are missing out on preventive care that could have been offered, and we could have maybe caught their cancer earlier or even prevented it altogether. So, people would ask me well, why didn't anyone tell me about this before I got cancer? And honestly, there's no good answer for that. Research shown that physicians often don't feel very comfortable with genetics and, aren't always aware of the red flags that they, mean somebody should consider having genetic testing. There's a number of other barriers and things that patients and both physicians face, but it's kind of its own systemic issue, and just that's sort of where the thought came from. So to kind of try to combat this gap that I was noticing, I started HealthyGene, in that I wanted people to have access to genetic and counseling and testing before they were diagnosed so that we can be proactive about their risk. So through HealthyGene, I offer genetic counseling and testing, primarily focus on cancer, but also I'm doing some stuff with some other diseases as well. So yeah, that's kind of where that came from.
Awesome. All right. So as a genetic counselor, what do you see as the biggest misunderstanding that the public has about hereditary cancer risk?
Yeah, I was thinking about this, and there's a few different things. So I'd say most people often don't even know that cancer can be hereditary, or that genetic counseling or testing is available, and that it can help them better understand their cancer risk. And, if you don't know something, you can't do anything about it. So, and the people who are aware of genetic testing, it's often a barrier because they don't know, does this apply to me? Should I be getting testing? Or is it just something that's for other people? I really can't blame people. It's very confusing. There's these guidelines that, insurance companies use to decide, should genetic testing be covered for this person or not? And they can be really complicated. Like you have to take into account how many people are in the family have a certain kind of cancer, what ages were they diagnosed, and like what side of the family they're on. Like it's complicated. So, I feel like I don't know that it's often quite like a misunderstanding about hereditary cancer so much as it's like a lack of awareness. Yeah. And I guess, one other thing, one true misconception that people have that I think can be a big barrier is this idea that genetic testing is really expensive. And so, costs have actually come down quite a lot. And if you meet your insurance testing criteria, like testing might be fully covered by your insurance. And even if they don't cover it, testing from like a reputable medical grade lab can be as little as $250. So, it's actually way more accessible than I think people are aware of.
Yes. And then there's organizations too. If your insurance doesn't cover it, you want to get this testing, there are resources available that can potentially helping you pay for it.
Definitely.
And we can put those resources in the notes as well. Okay, good. Thank you for that. So I kind of want to preface this question with how I believe you and I connected on LinkedIn.
Yeah.
Was a reaction to a post by somebody about a missed opportunity with President Biden's cancer diagnosis, and that it was a missed opportunity to discuss hereditary cancer risks. So my question to you is, why do these moments matter so much, and what could have been done differently?
Yeah, definitely. So I guess just as a reminder to make sure everyone's on the same page, President Biden was diagnosed with an aggressive metastatic prostate cancer a few months back. And because most prostate cancers are slow growing, an aggressive metastatic prostate cancer is more rare. And we actually know that around 10% of people with metastatic prostate cancer have a gene mutation that contributed to them developing that cancer. So because we know this, we say genetic testing should be offered to anyone who has aggressive or metastatic prostate cancer. So back to how we connected and his diagnosis specifically. There was a lot of media coverage out there about the diagnosis itself. Like, what is metastatic prostate cancer? What's the treatment? What's the survival like? And their main call to action was really focused on like the importance of getting prostate screening, which, obviously is a very important call to action and things that men should really be aware of.
Mm-hmm.
But what I wasn't seeing was any mention of the availability of genetic testing for prostate cancer risk, and especially in like the context of a metastatic diagnosis or maybe other family members with different cancers. And, so I think these moments can be really important because it's just like a natural opportunity for us to educate like the public about the availability of like prevention for cancer, and genetics is one part of that. So when public figures share their diagnoses, people really pay attention, they're interested, they want to know what happened to them. So when we can like slip in some of these like calls to action and education, I think we should be doing it. And, we're not really taking advantage of all the opportunities that do come up kind of on the day-to-day world.
Well, there's one very notable celebrity who really was a game changer for the BRCA genetic mutation. And that is the Angelina Jolie Effect that we often reference. And I've referenced it on the podcast, even did an op-ed in my local newspaper about it because, that should have served as a platform for prevention and awareness as well. And I think it did do a lot of that, especially in the BRCA risk pool, right? But I think there's a ways to go. And in building awareness for things like Lynch syndrome, which is as prevalent, but not as well known. So that was a transformational moment, right? That moment was a game changer for sure. Gosh, how many years ago was that now? I think we've
about 12 years ago.
Yeah. So it was quite a few years ago. It was a game-changing moment, but there's others that may fall flat. So what is happening here? Why do some fall flat and one raise such a significant awareness?
Yeah, great question. I think one of the main like differentiators of that moment was that it was like 100% about genetic risk of cancer. And Angelina making like a choice to reduce her cancer risk. It wasn't, diluted, I guess, by a cancer diagnosis or like a concern for her immediate like well-being by her fans and the world. So I feel like just that hyper focus on genetics really, was the main differentiator. And I think, 12 years ago when she announced that she was a BRCA1 gene mutation carrier, the idea of having preventive surgeries really seemed more radical. And her being just 37 at the time, really combined with her celebrity, really just grabbed people's attention. And I think like a lot of women probably saw their own stories within Angelina's. Maybe they too had a family member with breast cancer or ovarian cancer. And hearing about this made them think, Angelina's doing something. I should do something too. So yeah, just learning more about Angelina's family history and what she did, I think led a lot of women to learn more about genetic testing as an option. But with the more recent public cancer diagnoses like President Biden's or Olivia Munn's breast cancer diagnosis, the media is really just focused on the cancer diagnosis itself, and genetics sort of becomes like a footnote or just not mentioned at all.
Yeah, so we see this as an opportunity for the media maybe to reframe the narrative, right? And have a conversation maybe more around the public health storytelling, right? How do we take those experiences and turn them into some kind of call to action to prevent cancer? What do you think that they could do? The media, providers, people, influencers, whoever it may be, give us your thoughts on that.
Yeah, I'd really like to see the media, I guess, kind of take things a step further. We focus on, oh, this is the diagnosis, but a lot of times we don't ask like the why, like why did somebody get cancer so young? Or why did they have this metastatic disease? So there's really a chance to kind of educate people more about that. I mean, I'd really like to see the media add genetics into this story as sort of a potential answer to the why, and sharing more information and including like a call to action. Like, these are the reasons why somebody might consider genetic testing. Like, Olivia Munn was diagnosed under age 50 with breast cancer. So genetic testing is something that she should have been offered. I think it may have been, and I think she may have been negative, which, is good. But that's also an important, touch point in that it lets people know and kind of normalizes genetic testing as part of like the diagnosis process.
Yeah, I think it's helpful too that if you get the genetic testing before you have a diagnosis, it's important to note that that can also drive your treatment plan.
Yes, definitely.
And so that's another, like you said, another footnote or another element of that should be more than just a footnote. Like, genetic testing can prevent the cancer, but should it come up, it can also drive your treatment plan. And for Olivia Munn, like you said, if it was, I think you might be right that she didn't have a genetic mutation, that's a win. But she still was able to use her large platform to share the message of genetic testing and the importance of it. Yeah. Okay. So let's talk about the systemic gaps in messaging. So what are the risks of skipping these conversations or just not having a clear call to action? What is the outcome going to be if we don't continue to do this? Because I think you and I, our connection is not just talking about genetic testing in general, because obviously that's, where your strength lies. But the larger issue that we're facing right now is just the risk to research and research in general.
Yeah.
So, what are the risks of these conversations and reducing them to the general awareness in our country?
Yeah, I feel like if we skip these conversations, we're either just going to stay where we are now, or depending on, what happens with the legislative situation, maybe it could get worse. And, where we are right now is we're missing up to like 50% of the people with cancer who should be getting genetic testing. And that's not even mentioning the people who are at risk but don't have cancer yet. I think there was a study a few years back that estimated that there's at least like about 1 million people out there who probably have a genetic mutation, but they don't know about it. So I think we really need these like calls to action along with any awareness campaigns that are out there. It helps people make more sense of the information that they're receiving and like put it into a better context for themselves so that they can really understand like, oh, this really does apply to me. I should be paying attention to this. Maybe I should. Because it all just really comes down, I think, to understanding your risk. And once you understand it, like, you can take action and take control, and it doesn't control you anymore,
Yeah. So what would you say, how can we encourage these conversations earlier, like before someone's facing a crisis? Because like you said, some people might not be having this conversation until somebody they love has cancer. Mm-hmm. And then all of a sudden it's like, wow. And that's probably the case for many of us. I had sporadic cancers in my family, but for me, it wasn't the cancers that actually led to my genetic testing. It was another layer of understanding my risk because I have extremely dense breasts. And I was shocked to learn I had 2 genetic mutations.
Right.
Now I can do something about it, right? So how do we encourage those earlier conversations, like with patients, their families, maybe their primary care providers?
Yeah, I think this all kind of comes back to awareness. If you aren't aware of hereditary cancer or genetic testing, you can't have a conversation about it. So, I really think to encourage these earlier conversations, we just have to continue like spreading the word and making sure and encouraging people to talk with their family members about their family history, even if there's not a current diagnosis in the family, just like, well, what did grandma pass away from? Like knowing these things are important for your healthcare. They can change what your doctors do like on your day-to-day medical care, but can also say, hey, maybe genetic testing is something you should consider. So yeah, I really think we just need to like continue to spread the word like on social media. That's important, but also like I'd like to see us kind of go beyond that and get more in the mainstream media more regularly. And then, the awareness of hereditary cancer issue also applies to like primary care providers. It's gotten a lot better in the last 10 years, but, I think I mentioned earlier that often PCPs aren't very familiar with like when somebody needs to be referred for genetic counseling or genetic testing should be done. Plus, like these guidelines change a lot. So how are PCPs really supposed to like keep up with all these changes? And they have a lot of things on their plate and like very little time to get them done. So awareness is like one piece of the puzzle, but there's also been some talk in the genetic counseling community lately about integrating genetic counselors into primary care offices themselves and how genetic counselors could maybe help like collect more complete family histories and then facilitate proactive genetic testing.
That's brilliant.
Yeah. So I think, kind of this two-pronged approach. Like we need providers to, be more aware, but also we really need to just make sure that people themselves know. Like we can't just focus on the providers. People need to know about and be aware so that they have the tools and like the knowledge to advocate for themselves.
Not everybody has that innate sense for self-advocacy, right? Some of us we go into, I've talked about my own approach, I come in with like pad of paper and like studies.
Yeah, you're involved.
I am very involved. Yeah. And, but not everybody's built this way. And I've said this before as a recommendation to people is having somebody go with you to your appointments. And if you have a virtual appointment, like I've done with my sister when she did her genetic testing for hereditary cancer, she just found out recently she has Lynch syndrome as well. And I was on the intake call with the geneticist. And then we did the call together with the results. And, she knew there was a chance, but she's like, I don't even know what questions to ask. Can you be there?
It can be really overwhelming.
It really can. And I think it's, I could go into it with very calm sense because I've already been there. I've experienced it. I'm not letting, the cortisol get in the way of my head thinking correctly anymore. It's not to say that I wasn't, anxious about her results for her, but I was certainly I was carrying less of that weight. And so she could just listen and I could take notes together and then we could reconvene after she had a moment to sort of let it digest. So what problem are we trying to solve right here? And like you said, is just getting started with awareness and leveraging the media and maybe to some degree our primary care physicians.
I think we all sort of expect our doctors and healthcare providers to know everything. And while that's a beautiful goal and idea, they're human too. And they make mistakes. And especially when it comes to genetics, like they get, I don't know, I think a class maybe of genetics in med school often. And then it doesn't show up again in their residencies and the rest of their training. So it's not ingrained in them to think about the why is this happening or think about like the entire family. It's really like, patient focused. I just think awareness amongst providers is good and helpful, but like people need to really know that their doctors aren't superhuman. It's good to ask questions. Like if you think something's going on, like from a genetic perspective, like ask, like, do you think this is something I should look into? And if they're not sure, hey, there's genetic counselors. I love seeing people who just are curious, like, I'm not sure if this is a thing, but maybe it's something I should do. Like, let me help you.
Yeah. Yeah, for sure. I mean, and that's an important part of your role. It's not just understanding genetics. And we've talked about this before on the podcast, is the counseling element, is talking people through what to expect with the genetic testing process, and even making an assessment if they really need to have it or not, So yeah, maybe you could speak to that.
Yeah. Part of the genetic counseling process, like you said, is the counseling. So it's really trying to help people make informed decisions about their healthcare and genetic testing specifically. We try to outline what this information can tell you and what changes might need to be made based on these results. And for some people, they have no idea about this coming into the appointment with me. And so it's an opportunity for me to, inform them, but also to help them make a more informed decision. Like, there are some people who realize after they talk to me that I don't want this information. This is going to make me so anxious. And then, okay, you don't need to do genetic testing, but we do need to manage your risk based on what we know about your family history. So even if you just talk to us and don't do testing, sometimes we can make recommendations, change your medical care based on that alone. But yeah, just helping people try to go in informed and knowing what to expect is kind of my goal when I see my patients.
Yeah. Getting back to advocacy and some action, what do you feel should happen, whether structurally or culturally, really for prevention to become part of the way we talk about health, not just treatment, but health, especially in the hereditary cancer space?
Oh, man. Yeah,
it's a big question.
Yes, right. I think there's just a lot that needs to shift in order for prevention to kind of become more of the norm, both systemically and culturally. Our healthcare system itself, I'd love to see it shift more from this reactive to a more proactive approach. And this is hard for a lot of reasons. We've been doing things a certain way for a very long time, and change is difficult. And one of the other big issues is health insurance and how they kind of pay for services. Traditionally, they pay doctors and hospitals using a fee-for-service model. So basically, you see a patient, they do a test, they get paid. No matter what the outcome is, you get paid for doing the thing. And then, but more of a shift to value-based payment models, I think could help with this transition some. And with value-based payment, it's more the payment is tied to the quality of care and improved health outcomes. So, providing some kind of a financial incentive to get us shifting more to proactive health, I think is one thing that could potentially at least, help move the needle. But I also think, it's not just about our healthcare system or health insurance. We need to retrain the population to think proactively too. People know to come to the doctor when they have a problem. My knee hurts. I need to fix this because it's impacting my life. But if your knee doesn't hurt, you're not going to just go in for no reason. But making sure that people know, hey, come in when you're still healthy. That's important so we can keep you healthy. And I don't know, we've been talking a lot, we also need people to be their own health advocates. And like I said, kind of healthcare providers are just people. They make mistakes. You can't know everything.
What do you see in your patients? What does that look like to you when they're advocating for themselves? Is this them coming to you? I heard something on TikTok or Instagram about this genetic testing thing, which is a lot probably what people see and hear these days, hopefully.
Yes.
So what does that look like to you when somebody is truly embracing that self-advocacy?
Yeah, I guess for me, in my practice specifically, it's when I see my self-referred patients, you're taking a step beyond just your doctor saying you need this thing. You're seeking out information and counseling as to how to move forward. And I think, just more with your doctors and stuff, it looks more like showing up prepared, having questions. I'm sure there's resources out there that are kind of here's the questions to ask in this situation.
Yeah.
Come
Yes. Oh yeah. Use ChatGPT.
Yep. Use ChatGPT. Perfect. Or asking a family member or a close friend to come. Having another set of eyes and ears is always helpful. So
for those that maybe are feeling a little overwhelmed and self-advocacy is not something they're comfortable with, or maybe they're unsure where to start. Like, what's one thing that they could do to feel more in control of their hereditary cancer risk, or just in general, right? We have people who listen to the show that aren't just necessarily for hereditary cancer risk, but what is one thing that they can do if they're feeling unsure?
Yeah, with genetics, I'd say like the best thing people can really do and start is just by knowing their family history, talking to their family members to better understand like what conditions are in the family. Do multiple people have the same condition? Were they diagnosed at younger ages, or was it something more like in their 80s when we, sort of expect people to start getting more health issues? And just knowing that, if you see multiple people in the family with the same or like a related type of cancer or a young age, it's a good idea to consider talking to a genetic counselor. We can really be a good resource for information. So I think knowing your family history is kind of the best place to start, but then it's the what do you do about that we see the action.
Mm-hmm. Yeah, I think some people do get anxious, right, about going through the testing process. I think, actually, let me back that up. One thing we do want to point out, and I like asking genetic counselors that I've had on the show re-emphasize like the 23andMe ancestry DNA tests. Remind our listeners, this is not the genetic test. And we should move this to the front of the podcast, honestly. Those are not the cancer genetic testing that we're talking about here. Can you clarify that point for us?
First, you might not be getting accurate information, and that's why you should never use direct-to-consumer testing to guide your healthcare decisions. You need to get it confirmed from like a medical grade lab. And then, so if you think of like your genes, like a sentence in a book or an entire book itself, when we do medical grade testing, we like read through the entire book. We look for any spelling mistakes, grammar problems that like might make that gene not make sense and make it not work anymore. But when a lab like 23andMe does testing, they only check like specific spots in the book. They're looking at page 5, second paragraph, line 2, and maybe page 73. It's not usually comprehensive. So things can be missed in that way as well.
Before we wrap up, let's get back to the advocacy and action piece, because I really want the listeners to walk away, especially if they're in the advocacy space, they're on, sharing their story on social media, maybe some public health professionals, what can they do to help close this awareness gap?
Yeah, in thinking about this, I think we just have to keep being loud, and we really need to try to meet people where they are. And where people often are these days is online or on social media. And, traditionally, I think at least healthcare providers and, probably more in the public health professional space as well, we have a little bit of a social media aversion, which, makes sense. But hey, if we're trying to spread this message, like social media is the main platform we have as like individuals. So while I think social media is great, though, I also kind of think, sometimes it has a way of amplifying like your existing world and your existing viewpoints. So, sometimes I question like how successful is it in getting out like new information to people who are already tuned in? Or we're relying on the algorithm to just magically find these people. I can sometimes feel like it's screaming into the void or like preaching to the choir when I like post things. And, maybe part of that is just we need to be better like with our calls to action and telling people what they should do with this information. If it's not applicable to them specifically, like, hey, send this to someone you love who has a family member with breast cancer. And just calling out like the information and like who specifically should be taking action on this.
Of that.
Another thing I've kind of noticed is that, I've been seeing a lot of posts from like Susan Komen and other like cancer awareness organizations and working to raise like awareness on early onset cancer diagnoses, which is awesome. People need to know that just because you're in your 30s or 40s doesn't mean you're not going to get cancer. It can happen. And they're great about like informing people about the signs of cancer and why screening is important. But in their posts, I see less about information about genetics. Maybe as advocates, we can collaborate with them a bit more. specifically on the awareness of hereditary cancer. And I just like to see them kind of normalize genetic testing in some of these posts. Like when they're covering a story about someone who was diagnosed with breast cancer or colon cancer under age 50, like they should be offered genetic testing. So adding a sentence or two like, if you're diagnosed under 50, you should be thinking about genetic testing. And even if it was a negative test result, like it's still an important thing to make people aware of, because we won't know if you have a mutation unless we test you. So yeah, I think just raising awareness and trying to get more into the mainstream media more.
Mm-hmm.
I hate to say like capitalize on the diagnoses of public figures, but like they're sharing this information presumably to, help other people. So we need to take advantage when we can to spread the information.
Yeah, absolutely. Yeah, I was going to ask, like, give me an example of what you would like to see, right? And you gave a little bit when we were talking about like President Biden's diagnosis, that there should have been some kind of footnote in there about genetic testing because of the type of cancer that he had with metastatic prostate cancer. But if we do have people that are in the public eye that are listening to this, what is the message for them? What do you want them to say?
Yeah, great question. I guess my message to them would be like, thank you for sharing your story. I think it really does have a big impact on everyday people and, how they see their healthcare, but also just, I know genetics can be a difficult conversation and it's a very intimate. So I can understand maybe not wanting to share too much about genetics publicly, but if you feel comfortable talking about it, I think can have a big impact just to start the conversation and amongst families. Like we're kind of like Angelina's family. Like we have a lot of breast and ovarian cancer. So there's a real difference, I think, that could be made by sharing that information, especially from people in like the public.
Yeah, I think so too. On our episode with Dr. Vicari and Dr. Ditchfield from the University of Sheffield in the UK, we talked about people publicly sharing their predispositions and their experiences on social media, and specifically around BRCA and Lynch syndrome. And, while there are some of us that are very open about it, and my family is totally fine with it, because just because they're my family doesn't mean they also carry the gene. And like I said, we found out my sister does, but she was totally fine with me sharing her story as well. But I do think there's that dynamic of the uncertainty of people sharing it because it may affect their family members as well. That is a delicate conversation to say to your family, like, hey, I feel compelled to let people know about this, that they can prevent cancer. And, I think that's something that I want to tell the world. I mean, how do people navigate that conversation with their family? Because if you're like us, we want to amplify this message of prevention and being proactive and self-advocating for your healthcare. That's what this looks like, right? So what advice do you have for those folks?
Yeah. That's the thing about genetics is we like to keep it in the family.
I love it. That was a great punchline.
Yeah. So I feel like navigating those conversations can for sure always be tricky. I think, for those who are compelled to share their story, like I said, I think it can have a real difference for people, but definitely talking with your family members about it and just starting that conversation, I think is important. It's better for them to hear from you that you're thinking about doing this rather than hear from the op-ed you published in New York Times. And just knowing like it's not necessarily a one and done conversation, like introduce the idea.
Mm.
If they're on board already, great. If they're not, or they're like a little hesitant, like, okay, maybe we think about this and let's touch base again on this later, because it's something I'd really feel like I need to do. And just kind of keep that conversation going.
Yeah, that's good advice. Is there anything that you wanted to speak to sort of the landscape that we're facing right now with the impact to healthcare in general in the U.S., some of the policies that we're seeing? I know it's a delicate question for somebody who works in, the healthcare field, but what are some notable things that we should be paying attention to right now?
Man, great question.
This was not on your questions, but I'm like, I gotta know, like what you're thinking.
I think the big thing that's one of the things that's been sticking out to me is, just this big, beautiful bill and how the impact to research and cuts in funding, as well as cuts to like Medicaid health insurance for people. Like millions of people are losing their access to healthcare. What do we do about it? I mean, I think like continuing to go to like advocacy days like you are and talking to the people who make these decisions in the Capitol and on a state by state level is really important, and let them know like, hey, we're not happy with this. Research is so important. It's how we get to better healthcare and for everybody, and like making sure everybody has access to healthcare. It shouldn't be this like privilege to be able to get treatment for a health condition or to learn that maybe you have this risk for cancer.
Mm-hmm. That's helpful. You and I are very aligned on that thought, on that sentiment. Alrighty, so as we wrap up, do you want to share any resources through HealthyGene or any other resources you'd like to recommend for people that are maybe just beginning to explore the risk?
Like I mentioned earlier, first, knowing your family history is super important. So after having that conversation, you're going to end up with a lot of information, but maybe be staring at that piece of paper being like, okay, great. What do I do now? So one of the most good things to know about is how can I take this information and make it into something like more actionable for myself? And like I mentioned before, is one of the most difficult things personally that I think is that people don't often know like if or when they should get cancer genetic testing. So in an attempt to sort of solve some part of this problem, I have been developing a risk assessment to try to help people figure this out. Like, should genetic testing be something that I'm doing or should be thinking about doing? It's called the Know Your Risk quiz. It's free on my website and it takes about 5 minutes, so not too long. And it just asks you several questions about your personal and family history of cancer. The purpose of it is basically to screen for signs of BRCA1 or 2 gene mutations, as well as Lynch syndrome. So if you screen positive on that quiz, it means genetic counseling and testing is, probably something you should consider. Doesn't mean you have to do testing or anything, but, being aware of this and talking to a genetic counselor is probably a good next step. For those who screen negative, you likely don't need testing for either of those 2 conditions. But if you still have concerns, again, seeing a genetic counselor could still be beneficial. There may be something else hereditary going on in the family that the quiz doesn't cover, but a genetic counselor would spot. So yeah, I think, taking that step and after understanding your family history, either taking this quiz for a low barrier entry point or scheduling an appointment with a genetic counselor is a great next step.
All right. And they can go to NSGC. Is that right?
Yeah, to find a genetic counselor. Yeah, there's a findageneticcounselor.com, I think it is. So there's a whole page you can put in, your state and what specialty you're looking for specifically, and it'll come up with a list of genetic counselors either in your area or who offer telehealth appointments.
Yes, which HealthyGene does offer. Yes?
Yes.
All right, good.
I actually only do telehealth. So, again, trying to make that easy for people to get in.
I love that. I appreciate that you are doing everything you can to create a low barrier experience for people trying to navigate this journey of genetic testing. So kudos to you for that. All right, where can our listeners connect with you and learn more about your work?
Yeah, so they can check out HealthyGene's website, which is myhealthygene.com. They can also find that Know Your Risk quiz on the website. Of course, I'm also on social media, Instagram, Facebook, LinkedIn, all the good stuff. There's links on the website to all those accounts. So if you'd like to follow, that's probably the best place to start.
Thank you so much for sharing your perspective and passion for closing the gap on what we know in science and genetic testing, and then maybe what people are truly experiencing out in the world. So appreciate your time today.
Yeah, for sure. Thank you so much for having me. I appreciate it.
All right, for our listeners, if you've ever felt like the conversation about cancer stops at treatment instead of starting with prevention, let this serve as your reminder that knowledge is power. And hopefully we conveyed that for you today. So it's never too early to ask questions, learn your family history, and then just take steps to protect yourself and your loved ones. For links to HealthyGene and the resources mentioned, please check the show notes and the podcast blog. Don't forget to follow for episode updates and snippets from the conversations that we have on video. So as always, thank you for being a part of this community where we have open conversations like this and take proactive steps that will make a difference. So All right, until next time, take good care of yourself. And remember, asking the right question today can change the story for tomorrow. Thank you for spending time with me on the Positive Gene podcast. Your support means everything. If you found value in today's episode, I would be so grateful if you could take a moment to rate and review the podcast. It truly makes a difference. For an in-depth look and links to resources discussed today, check out the accompanying blog on my website at sarahkavanaugh.com.